Hi, welcome to Nursing School Explained and this video series in the Nurse Interview playlist. Today, I'm here with Mark Cayco, who currently works as a nurse case manager for the Navy Hospital, but he also has a very interesting background and a very good variety of different nursing experiences. So welcome, Mark. Thanks for joining me.
Hi, thanks for having me.
Yes, thanks for being here and for offering to share your awesome nursing career. How long have you been a nurse now?
Since 2000, since 2000, it was like 99, but 2000.
Okay, so over 20 years. That's a lot of years. And
Yeah,
tell me about, sorry?
it's gone by fast.
I bet. Tell me about your nursing journey.
So for myself, I originally was a criminal justice major, kind of lost, wasn't sure. And I wanted to become an EMT because I saw some classes at the junior college. And then a friend of mine recommended joining the Army Reserves as a medic. So I became a EMT medic in the Army Reserves. And I learned the basics of, C-collar, splints, litter carry, ambulance type stuff. And then the Army Reserves, after I finished my initial training in Texas, I came back to San Diego, and the Army Reserves had a program where they would pay for LVN school. So I went to LVN school at a civilian school in San Diego, and the Army Reserves paid for the whole thing. So that was a great deal. After I finished the LVN program, I passed my LVN boards. I went back to the Army recruiter and said I wanted to go active duty, but I only wanted to go to Germany. And so it took 2 months, and they said, yeah, we have a hospital spot for you in Heidelberg, Germany. And in 1995, summer of 95, I went there, and it was a great experience. I worked med surge for about a year, and then I got loaned to labor and delivery. So I helped out there doing the mother baby type duties. And it's been a great ride.
How long did you stay in Germany?
I was there for 2 years. 2 years.
2 years. Straight. Okay. And then when you came back home, how did your journey continue?
I went, so I was LVN, and then I did a RN program with, it's like before University of Phoenix. It was like they called it Excelsior. And it was kind of like I challenged some tests, and then I got my 2-year RN through them. And then I was working for Planned Parenthood as an LVN, and then I got my RN, and so they kept me on. And then Planned Parenthood had some sort of funding. I want to say they called it Title 10 funding, but I'm not entirely sure if I remember correctly. But it was a women's health nurse practitioner program. And this was in 2001 at Harbor UCLA in Torrance in the LA area. And it was a 1-year program specific to family planning, pap smears, infection checks, stuff of that nature. And so I did that program, and then I worked for Planned Parenthood about 10 years. I was working for them part-time because in 2001, 9/11 happened, of course, and that changed my mindset. And I basically was leaning away from GYN, and I wanted to get ER experience. And so I kind of literally, with no ER experience at all, went to Sharp Chula Vista here in San Diego. I went to the ER, and I walked in and I said, hey, I don't have any ER experience, but if my Army Reserve unit activates me for the war, I need some. Would you hire me? And they did. And so really out of my element, but I think I took to it pretty well. And then I ended up doing ER and Planned Parenthood simultaneously for a number of years, and then ER only for about 12 years. So, and then after that, I switched over to the Navy Hospital. I was originally working for Sharp, and then I was ready for a change, and switched over to the Navy Hospital. And then maybe in 2015, I left the ER and went to the PACU. And so from 2015 till 2021, PACU, and then I actually was ready for another change, and so I went to case management about 1 year ago, and so that's where I've been ever since.
Okay, so a couple of things. Thank you for sharing that. A couple of things
Yes.
that I want to touch on that some people might be interested in. So you pointed out that I think it's called the GI Bill, right? Where the military helps you pay for school, for specifically for nursing school. And I think there's other careers too. And then also that Title 10, or maybe it's a different number of the title, that funding. So it sounds like you went through your schooling with a lot of help through like public funding and public grants. And is there some additional information that you can share on that, about that? Because a lot of young people nowadays are struggling with financing, school and their career and all that. So if there is an opportunity for free money and some really, really good career training, I want to make sure that we share that.
Yes. The Army Reserves, they have several programs, and one of them is the GI Bill. And that's more for when I think you do your time and then you get out and then you go to college. There are some people who they still go to college while they're in, which to me was always pretty intimidating because the Army can kind of mess up your schedule and then mess up your school plans. So I think most people do use the GI Bill when they're out, and they have more freedom to go to school and focus on school. I also used something called tuition assistance. And that was really great for me because when I did some University of Phoenix classes, and I want to say the tuition assistance paid for like 80% of the class. And some, I would say maybe 50% of any fees and things like that. So the tuition assistance helped out a lot. About the Title 10 funding, that one was specific to California. So I'm not sure. And it was specific to family planning. And I think, and I do know that since then, certificate trained nurse practitioners have been kind of phased out, and everyone has to have a master's, which wasn't my only reason for kind of fading away from that area, but it was a factor. I also did get busy with life, and I couldn't give 3 jobs to enough time. But I do believe Title 10 funding is specific to family planning, so that might be something to consider if they're in that field already. But I don't know if it would be helpful if they were not in family planning work. But
yeah, that makes a lot of sense. And I think the important thing is to note, for anybody who's interested in a specialty area of any kind, or really any kind of schooling, just do your research. Talk to people that are dealing with scholarships and grants and tuition reimbursement and assistance, because there is a lot of money out there that a lot of people don't know about, and then it goes unclaimed, and then people end up with a lot of student debt that doesn't necessarily need to happen.
yes, totally agree. And sometimes, actually often, when I was in the ER or the PACU, when I would talk to nursing students who would come through, I'm definitely biased towards the military because I've had a really positive experience. I would think I know for a fact my experience has been very positive. So I would be encouraging, hey, you should join. And I would point out, people, see that CRNA right there? He got all his school paid for, 100%. See that guy, that physician? He came in as a mechanic, and now he's a physician, because there are lots of programs in the military. Now, they don't just give it to anyone. You have to have good evaluations and be, very competent in your area. But there is amazing programs out there, especially in the military.
Mm-hmm. Cool. Thanks for sharing that. So since you've been coming across a lot of different nurses with different experience levels and also different backgrounds, inpatient, outpatient, and then several different departments in the inpatient setting, when you encounter a new grad who comes in working with you, what advice do you give them? What do you say? Hey, when I graduated 20 some years ago, I wish they would have told me this.
Glad you asked that, because I do think about the young nurses as they came through the ER and the PACU. I don't encounter them in case management anymore, and I do kind of miss that. I always tell them, hey, if you're going to do the hard stuff, you should do it early. Do ICU, do ER, do the crazy stuff early in your career. And I really think that builds up your confidence, because I dabbled. I was med surg as an LVN in the Army. It wasn't super high acute area. And then when I did go to the ER, that was after a shift from wanting to be in GYN to ER. And that was a little intimidating to go into an area. Although it was by choice, I was jumping in because of the war. I thought I better get some ER experience, and it was pretty intimidating. So I definitely, if I could have done it all over again, I would have done ER ICU right from the get-go, have that done and, say get 5 years of experience. And that would just be a really solid foundation so that anything else after years 5, and beyond would just be, oh, that's nothing, because I was dealing with ICU stuff already. So it was pretty nerve-wracking jumping from the GYN clinic setting into the ER. So that's something I tell the new nurses coming through. I also do, like I said, I'm really biased. I really encourage them to consider joining the military reserves at least, because as a nurse, I really think the opportunity for adventure, travel, money for school, I really think it's there's no words. I mean, it's such an amazing opportunity for a lot of these new nurses. And then they can do it early in their career. They don't like it, 5 years, they're done. So.
Yeah, that's a very good point, I think. And I like what you said about jumping into the critical care areas first, because not only is it a super fast-paced environment usually, but it's also a little bit more taxing on your body. So while you're young and you're still strong and you don't have any injuries, not saying that nurses typically get injuries. If you take care of yourself and your body, then hopefully you can avoid those. But I think it takes a certain physical strength too to kind of work these jobs. Yeah, you always have support with your teammates and your CNAs that support you and all that. But I think also if you get that in early, you kind of maybe get that adrenaline kick out of the way initially, and then you can kind of go into a position that's a little bit more calm and not so taxing, both physically and mentally.
I would definitely agree with that, because even though PACU is not overly taxing, there's a couple times where I was pushing some gurneys like, oh man, I'm getting a little sore here. So I think I had a good downshift from crazy ER life and then PACU to be a little bit more moderate. And then now kind of downshifting to case management, where of course it's more office setting. And, it's been a good change of scenery over the years. That's one thing I've been very pleased with nursing, is if you want blood and guts, it's there. You want adrenaline, it's there. If you travel nursing, of course you can travel. And then if you want to downshift to office life, the opportunities are there. So it's been good to me. I can't complain.
Mm-hmm. Yeah, I think that's the beauty of nursing in general, right? You really get one degree and there's 1,000 of different opportunities. Whatever tickles your fancy, you can go there. And if you don't have experience, somebody will hire you and train you based on your other experience that you've had. So I think that's a very positive aspect of becoming a nurse with just one degree and having so many opportunities.
That's a great point. And when you bring up the different areas, when you're asking me some advice I would give to a new nurse, and another thing I would mention, which worked for me, was volunteering a little bit. Like, if you can't get the job that you wanted, and say you're working in a different area, I think it's reasonable, and it worked for me, is to say, hey, how about I volunteer 4 or 5 hours on, 1 day a week or 1 day a month? And that's one way I got transferred from the ER to the PACU. That was within our hospital system. So of course it's a little bit easier, but I did reach out to them to say, hey, I think I did a conscious sedation class or a research in the PACU. And then I remember thinking, hey, I think I'm ready for a switch. How would you feel about me volunteering here like 1 day a month? And they said, fine. And one thing led to another. Networking. That's the other advice, I guess I'd say. Networking, it's key. The people you talk with in the year 2015 chit-chatting with, if you network, maybe in 2017 they'll pick you up for a job. So volunteering and networking is some other advice I would give.
Mm-hmm. And I think that's important too for new grads, right? If you're having a healthcare career, let's say you work for a certain healthcare system and you work as a CNA or an ER tech or a transporter or whatever it might be, you build rapport with different people, supervisors, other nurses. They see your work ethic, they see how you interact with patients, and then you graduate, and then you kind of plant that seed. Oh, I'm about to graduate. And then they know, oh, Mark, he was a really good ER tech. We should consider hiring as a nurse because we already know him. We already know what he is about. The skills we can teach him, right? But we know that he's a good patient advocate. He gets along with people. He shows up on time, all these things. So that networking is super important. And one thing that I always find fascinating, no matter where you work, nursing is a very small community. If you not even, I mean, the military is a huge entity in itself, right? Or big cities might have multiple big healthcare systems, but if there's a bad nurse somewhere, everybody will know about it. And if they apply, it might be really hard for them to get a job. But if you're really good, word gets around too. And so that it helps you initially or eventually, that helps you in general really, really well. Because it word gets around, and it's a big world out there. But nursing, I feel somebody always knows somebody who knows somebody else who knows this person. So you kind of the networking is important, but also, you know, don't get a bad reputation.
Yeah, definitely word gets around. Absolutely. And I think especially with the certain areas, like, I mean, I know just lots of ER nurses, and there's just a spider web of connection. Oh, you work with him? Oh, that, you know, at whatever ERs around town. And even coupled with the Army Reserves, when I go to drill weekend, when we chit chat, people will network and say, oh yeah, we're hiring XYZ. Oh, really? And that's another way that the Reserves is a great benefit, is because there's like networking at other hospitals. Like, yeah, I might know a lot at my hospital, but when I go to the Army Reserves, I find out a lot more about the 6 other hospitals in the city. So that's a great plus.
Mm-hmm. And then Mark, what is your commitment right now with the Army Reserves?
It's 1 weekend a month and then 2 weeks a year. I've been very fortunate to once in a while over the past 30 years to get some 3-week deals overseas. And those are really fun. So if they send you overseas for like a humanitarian mission, they're not going to just send you for 2 weeks because they want to, you know, make it more worth everyone's time. And so we did 3-week missions in El Salvador, Dominican Republic. Even we did regular jobs in Germany for 3 weeks, and then Japan for 3 weeks. So those are really amazing. But generally speaking, it's 1 weekend a month and then 2 weeks during the summer. Every once in a while, and of course things were different about 15 years ago with the wars and all the madness. You get activated, and for me, I got activated without volunteering 4 times over the past you could say 25 years, and then I leave San Diego for 1 year to work in El Paso, Texas, to replace a nurse who was working labor and delivery there, who then got sent to Iraq. This was in 2003. And so I ended up working labor and delivery in El Paso for a year. And then it happened again in 2009, but it was Colorado. And again, a nurse had to leave to who knows where. And then I replaced that person. And then 2012, it happened again. So it's kind of, it's a different tempo now, and hopefully it stays relatively cool. And then I worked the ER in Walter Reed for 1 year. And then the other time, there's so many, it's so funny, it's 4 times. In 2019, I got activated for about a year to go to Germany. And so that, of course, that was an amazing experience to go back to Germany. But that doesn't happen to everyone. Not everyone would be that lucky. That's generally the commitment, though. 1 weekend a month, 2 weeks a year, and then maybe an activation every 5 years or so.
Mm-hmm. And that sounds like there's some, like you said, some adventure involved there too, in going on humanitarian missions and necessarily not really doing like frontline military, like battle zone kind of stuff. And hopefully we won't have any more big wars coming up where we need that, but more on, I know, like aid, really helping the people of the country rebuild and have that experience. Not a lot of people have had that. And that is such a valuable, not only career experience, but also life experience, I think.
Definitely. It was, all of the humanitarian missions overseas were life-changing, because you get to see other developing nations and realize American healthcare, we all know, has problems, but to see how fortunate we are really, really hits you in the heart. and we had lines of 200 or 300 people waiting to either be seen by a doctor for the first time in who knows how long, 10 years, 5 years. We had people seeing a dentist for the first time in years and years and getting dental extractions. And so it was very humbling and very humbling yet rewarding experience, incredibly rewarding. To this day, the friends that went with us to those countries that I mentioned, we still talk about like, wow, that was a really great experience. So like I said, I really am kind of biased when I encourage these young nurses, join for the adventure, the travel, and have some really life-changing experiences.
Wow. Yeah. Thanks for sharing all that. So with all that experience that you have, Mark, what is the one patient interaction that you'll never forget?
You know, gosh, I had an answer, and now it's a little sad now to say it and have it be recorded, but it was
It's up to you if you want to share it or not.
I'll just say it was a suicide, a gunshot wound. And it was in our parking lot. It was all very sad and crazy and traumatic. And we're not a trauma center, so that's one reason it really sticks out in my head. But the other reason is that it just happened in our parking lot. And so as far as patient interactions and stories and craziness, all ER nurses have crazy stories. And of course, we can have a bit of a dark sense of humor or morbid sense of humor, gallows humor. But you know, when you ask which one sticks with you the most, that one sticks with me the most. It was just absolutely crazy. Very, very sad, very, very sad. But yeah, so on a more positive note, I'll think now, just shifting, I do remember taking care of a near drowning girl in Germany. She was American, but she had a near drowning incident at the German Schwimmbad, and she had lost a lot of motor control function. And I remember helping carry her when, you know, I was probably 22 at the time, and she was, you know, 7 or 8, maybe 6 or 7. And it's funny because I was helping her move and carry her, and I just recently, my daughter has reached that age, and my daughter was kind of she was sick and fussy. And so when I carried my daughter, it reminded me of that moment 20 plus years ago, like, wow, there's a big kid that I'm trying to lift. And that was another moment that stuck with me very profoundly, I guess you'd say. So.
And the girl, she was okay then, near drowning?
Yeah, she started regaining speech and motor function later. I wasn't taking care of her the whole time, but I do remember asking, like, how's she doing in rehab and therapy? And they said, oh, she's doing so much better. I never saw it eyes on, but that doesn't matter. But it was a good feeling to know that she was better.
Yeah, and there are those stories, right? There are the good ones and then are the bad ones, but some of them will stick with us for longer. And for the most part, I think the positives definitely outweigh the negatives. Sometimes those are just so traumatic, not only to the patient, but also to the people involved in their care, that they kind of come to the forefront of our memory when we talk about things like that.
Definitely. Unforgettable.
Mm-hmm. So with all of your busyness and your kids and your children, what do you do in your free time to keep work-life balance and keep sane and keep balanced?
I really like to go camping. I wish I could do it more, but basically camping and hiking and just kind of unplugging from the city, I feel is really, really important, especially if I'm not working a high stress life anymore, but I definitely think if you are working in a high acuity area, you would need to unplug and get away from the city once in a while just to get some nature therapy. So I do like to go camping, hiking, a little bit of fishing, and then bicycle riding with my kids. I really enjoy that.
So the great outdoors.
I try as much as possible.
What's your favorite camping spot or camping trip?
Well, in October of last year, we went to Yosemite. And I had been there like 25 years ago, but just with a car and car camping. But this time we backpacked and with some childhood buddies and backpacked all around for about 4 days. So it was a blast.
Wow. Out there in the wilderness.
Yes, it was a lot of fun.
Wow. I can only imagine the beauty that you saw right there.
Yeah, I loved it.
Cool. Well, any last words of advice or anything else you want to share?
I guess one thing I would say to any nurses that are curious about the military is you should do it. If you're thinking about it, do it. Talk to one of us and we'll try to give you the good and the bad. But the opportunity for adventure and travel and just meeting people all over the planet is something that's priceless. So that would be my I guess parting thoughts for any nurses that are out there that hear this info from me is if you're thinking about it, you should really do it. And if you don't like it after 4 or 5 years, you'd be done with it. It's not a lifetime commitment.
Yeah, that's a very good point, right? To see if you like it, like with anything else, just see if you like it. And if it's for you, then maybe you stick around. And if not, there's always time to change.
Absolutely.
Now, if somebody wanted to reach out to you personally
Mhm.
and ask, hey, Mark, I saw this video and I have some questions. Could they reach out to me and then I could forward this information to you? Would you be willing to talk to people?
Absolutely. I thoroughly enjoy, I've been in the Army Reserves 30 years now, and it is my job to prepare or talk to the next generation about joining. Not to just tell you the good, but to tell you the good and the bad so that you make an informed decision, especially for nurses. I mean, I'll tell anyone that wants to join the military my experiences, but of course for medical and for nurses, it is my job to get you guys to think about it. But I do like to be completely honest and say, hey man, there's some things that really are a big headache, but there's some things that are really great too.
Thank you for offering that. So I have a feeling there might be some viewers out there that might be interested, and then maybe we'll get some people connected to you. So Mark, I want to really thank you for your time and for reaching out to me to actually bring this video about military nursing here to the forefront, because I think everything that you've shared sounds super interesting. And if I was 20 years younger, I might consider it too. So thank you so much for everything that you have done and that you continue to do for our veterans and our active military personnel. And good luck to you in whatever that your next endeavor will be.
Cool. Thank you very much. I appreciate it. And it was a pleasure to be here.
Thanks so much. Take care.